microdermabrasion here is 150. When I do the microderm, we have a crystal-free machine. I don't just do the microderm. A lot of times I'll do a chemical peel, a light chemical peel depending on your skin, and a mini facial too. So I'm penetrating hyaluronic acid.
Raving about you.
I know.
I'm a terrific fan of you.
Yeah.
She's amazing.
She's a good client too.
What would be better, the microderm or the peel?
It depends on your skin. Sometimes both are what, that's why I do both, and it's a great way for me to assess your skin too. It depends on your skin, really.
My capillaries are very close to the surface.
Mm-hmm.
So sometimes I think I have rosacea, but it will go away after a while. So someone had mentioned doing the microdermabrasion, and then someone said no, that,
No. Yeah.
So what type of procedure would I do?
Well, because you have broken capillaries, that you may or may not have rosacea, but you have broken capillaries. So that means that your capillaries are dilated. So things like heat, excessive scrubbing, exercise, topical irritants are just going to vasodilate your capillaries more. So microderm, you can do on somebody with broken capillaries, but it's not going to really get rid of your broken capillaries. It can actually make them a little worse.
Right.
So what you want to do are things that are going to constrict those capillaries. And the thing that I have found that the only thing that really works is the lasers. It's called an intense pulse light photorejuvenation. It actually sees the hemoglobin in your capillary, breaks it apart, utilizing the light and energy, thereby constricting the capillaries. And the body gets rid of that dead blood by macrophaging it out, and then they're significantly reduced. But if you're prone to it, like some people are prone to that, could have been years of sun damage, childbirth, or hormones, or whatever, you just have to watch. So you have to use sun avoidance, don't excessively scrub your face, don't use too many irritating topical things, cool, calming things on the skin, not super hot showers, things like that. But the IPL works amazing on capillaries. It's probably one of the, I do the lasers for that, probably the most. That and brown spots.
So if would someone just come in, I'm so sorry,
That's
to come in for consultation?
Yeah, you sit down, you talk to me, and we go
And
over.
you would look over it?
Yeah.
Okay.
I evaluate your skin and I tell you what I think.
And is there a fee for that one?
There's a $30 fee, but if you do anything or purchase a product or anything that day, that gets taken off. So it's,
Okay.
Laura, I just had a question. You mentioned laser for skin tightening or firming, you said?
the laser that we have, there is a skin tightening, skin firming lasers out there. I've used those before. I have to be honest. I think that it's not as great as a result. So the firming that we get is with our resurfacing lasers. There's either the fractional lasers, there's non-ablative or ablative. The difference is just one's more aggressive. Because you're resurfacing the skin and you're building collagen and elastin, you get a skin tightening. Now you're going to get like a facelift, unfortunately, there's two things that people battle the most. It's deep wrinkles and loose skin. And sometimes when you get to that point, you have to be a little bit more aggressive. Again, some of these things they show on TV are just, I would look 12 because I utilize all this stuff. So. I still have some wrinkles, I still have
Now, for instance, the brown spots on your face, I'm sure that you have to do not only one treatment, there's a couple of treatments that have to be done before.
Usually it's about 1 to 3 treatments, but it depends. It depends on your skin. It depends on where the sun damage is. Like some people are fair skinned, but they have so much sun damage that it's really sitting in the surface of their skin. They get a huge result from one treatment. Some people have, like I had sun damage from years of doing it before, but it used to be really bad. So now it's significantly lighter. I just have to stay on top of it. Once a year I just spot treat and it stays under control. But because I'm Italian, I have olive skin, but I'm fair skinned, that does, my melanin's sitting right there. I'm the hardest to actually treat. Tan skin you can't treat. But now what's your ethnic background?
Hispanic.
Okay, so you're light skinned though. So and you're talking about like sometimes when people get, sometimes that's melasma, which is a hormonal issue with discoloration. And you can treat,
those things going on.
yeah, you can treat that with the lasers, but then there's also topical things that we'll give you to keep it under control over time. Like I have a melasma on the sides of my neck. I used to have it around, but lasers took care of all of that and significantly lightened it on the side of my neck, but now I just have to use topicals to keep it under control.
And the sun.
And
The sun is a
sun.
culprit, right?
Yes.
Does the lasers, the newer ones take care of the white hair, or just the
There's really, and I've used the lasers that say they do take care of the white hair, and it does significantly reduce it. We don't have that laser here. We have a laser that works on finer, blonde, brown hairs. But gray hairs, honestly, the best thing and the only thing that works for it is electrolysis. The lasers will reduce it and slow it up, but once there's no pigment in the follicle, it's hard for the laser. The lasers usually have to see a target in order to work.
So there is hope.
There's so much hope. There really is so much hope. There's so much hope. Well, what do you, I mean, we can talk more personally when you make consults, but there's hope. I mean, honestly, almost every patient, there's hope. As long as somebody has realistic expectations and they have a healthy psyche, in my opinion, there's almost anything you can do to improve how you feel and how you look. Again, you have to have realistic expectations, in my opinion. So there's sometimes people come in and they're like, okay, I want this, and I'm like, okay. It's like, okay, well, let's start here. Let's start with healthy, like sun avoidance and things like that. And sometimes just getting somebody to do sun avoidance, moisturizing their skin, doing a light peel, they're so excited and so happy that someone told them what to do, and they seriously they're just so happy. That was all they needed, because they just needed to feel a little bit better. And then there's some people that definitely have some sun damage that need to be removed, some wrinkling that the Botox helps. Some little things tweak and make you feel better, you look better. There's simple things.
Probably once you start Botox, though, you're not gonna stop, right? I mean, you're
Most
gonna
people
love it.
don't stop because it
Yeah,
really
so-
is a great, that's probably one of the most magical things.
Yeah, so once
Botox
you start, you're not
and
stopping.
IPL.
How
Some
long
people
does
do
that
that.
last? A shot in the eye, just,
It lasts about 3 months. Some people can get up to 6 months, but most people are about 3 to 4 months.
How much does that cost?
Depends on where you're getting it done. Like there's certain muscles that have to be injected specifically in certain areas.
Do you
So it's
do
not
that, or
like
does he
you
just do that?
I do it, but Dr. Jacoby has to do it first because I'm a nurse and he's a physician, so I work under him. So he initially has to do the injections and then I can do them afterwards. But I had to sound pretty good. I like doing it.
so after the 3
I'm due though,
months,
so don't look at me right now.
what happens after the 3 months? Do your eyes get, do they shrivel? I mean,
No.
I don't understand.
The way that Botox works is actually it's a toxin that inhibits the muscle contraction. So where you're injected, that muscle cannot contract anymore. For instance, like smiling hard there, if you got around the crow's feet, you'd still be able to move your eyes and blink and smile. You just can't contract really hard so those wrinkles get softened. So once the Botox wears away, it's not like nothing changes except now you can start moving that muscle more. If anything, Botox helps in preventing future wrinkles because you're not able to continually move. Like there's static wrinkles are there when you're not moving, and then there's dynamic wrinkles that happen when you move. It's working on those dynamic wrinkles because it's stopping you from doing,
So
this
you've
face.
had it over here, that's why yours.
Yeah, mine's still working here, but like here I'm due, a referral. Yeah.
So if you had it up here and you went like that, it would be just like it was over here.
It just softens it.
Mhm.
I mean, some people can get a frozen look. Dr. Jacoby he's a very natural. He looks at the contour of your face. You don't have to be afraid of looking that way. There's different muscles that can be treated.
And how long has he been doing this?
Dr. Jacoby's been in practice for 18 years. Yeah, 18 years.
Okay, thank you. Good.
Okay, so I'll do the drawing, and then do you want me